I can't imagine what it must be like to live with an illness and especially not knowing what's causing that illness. You've been reported to us as having an undiagnosed illness. However, the findings from this and previous work is suggesting that it's likely that you actually have an illness that can be diagnosed.
The Office of the Chief Medical Officer of Health announced its findings after the conclusion of their investigation into cases of undiagnosed neurological illness.
As many of you know, this investigation started back in early 2023 when one physician reached out to us to share concerns about many of his patients. These are patients who had neurological illnesses, so disease of the neurological system, the nervous system. But the physician also reported having test results that showed elevated levels for certain environmental substances, more specifically certain herbicides, which are products used to control weeds, as well as metals. He reached out to public health asking to assist him in understanding what these findings meant, and we agreed to help him with that. Our main objective in this investigation was to further understand the concerns brought forward by the physician about certain environmental substances. We wanted to know if the results were reliable or not, if they were higher than what we'd expect to find, and if they were in fact higher, if we could find evidence that suggested that they might be contributing to their neurological illness. The main finding from our analysis of the available data for this group of patients as a whole does not suggest that widespread exposure to these substances might have contributed to their illness. When we looked at the findings from the herbicides tested, we found that around 95% of the results received were within the normal or expected range when compared to the lab's reference ranges. When we compared the levels of this patient group to levels we would expect to see if we tested a group of Atlantic Canadians, the overall results were very similar. When we looked at the findings from the metals tested, some patients had elevated results, but the vast majority of tests done, around 93%, were within the normal or expected levels when we compared with the reference ranges. We encountered significant limitations that did affect our ability to provide definitive answers to some questions. However, we're still able to conclude that our investigation does not find evidence of a widespread issue among this patient group. Therefore, we don't feel that exposure to these substances is a contributing factor to most patients' illnesses. We knew when we started this work that it would not end here, but we did need to help a concerned physician answer an important question that certainly had implications for patient care. Now we need to focus on efforts on helping these patients get a diagnosis and the care that they need.